Welcome to a joint effort, and thank you for choosing Orlando Health South Seminole Hospital for your upcoming joint replacement. This class will help prepare you for your total joint replacement surgery by providing some helpful information. The intent is not to replace any information your surgeon has given you about your procedure. Your surgeon, therapist, or nurse may add to or change some of the recommendations based on your personal needs. If you have any questions about your specific surgery, please contact your surgeon. This will be a true joint effort. You have chosen to have an elective procedure to replace your hip or knee. So, we want to work with you to help you have the best outcome possible. So let's get started. Begin planning for after surgery. Make plans to have someone stay with you. This someone should be able to stay with you 24 hours a day to assist you when you're getting up, and they should plan to stay for at least the first few days until you're able to get up and move around on your own safely. Arrange for someone to collect your mail, help with household chores, and drive you to your follow-up appointments as well. You may also want to buy or prepare meals in advance that can be frozen, so all you have to do is reheat them. Preparing for surgery. These days, insurance companies don't automatically consider living alone a reason to go to a rehab or a skilled nursing facility. Besides, going to a skilled nursing facility increases risks of complications such as infection or falling. However, in some cases, if you live alone and have no one to assist you following surgery, please let your surgeon know. You can always consider family members, neighbors, or friends as caregivers following your surgery. Know your benefits. It's important to know what your insurance will cover for this procedure. Call your insurance company to find out exactly what they cover so you don't get a surprise bill. Know if they will cover things such as home health or durable medical equipment such as a walker or 3-in-1 commode. Find out what they pay and how much you will need to pay if you were to go to a skilled nursing facility. Next, we'll take a look at preparing your body for surgery. Just like an athlete preparing for a marathon, you want to start now to prepare your body for surgery. Start to eat a healthy, well-balanced diet that includes fresh fruits, vegetables, foods high in fiber, and lean proteins. You want to make sure that your protein intake is at least 1 gram per 2 pounds of body weight, unless otherwise told by your doctor, so that you can store these nutrients before surgery in order to heal faster. If you have diabetes, keep your blood sugar under control. A good resource for dietary guidelines is myplate.gov. Hydration is very important prior to surgery and after. You want to drink at least 8 to 10 cups of non-caffeinated fluid, such as water, every day before and after surgery, unless your doctor has instructed you otherwise. For those of you that need your coffee like I do, remember to drink these beverages in moderation to help maintain hydration. Why is this important? Staying hydrated allows for easier IV access, reduces nausea and vomiting following anesthesia, attributes to less pain following surgery, and stabilizes your vital signs during anesthesia. Overall, you'll feel better and heal faster by staying hydrated. Pre-op exercises are important to strengthen your upper body to assist in using your walker and getting in and out of your bed or chair following your procedure. You can use a small weight or canned goods for the shoulder flexion exercise on the left side of your screen, and an armrest on a chair for the push-ups on the right side of your screen. You can perform these exercises for 10 repetitions 3 times a day. Additional exercises include arm curls, shown on the left side of the screen, and elbow extension, shown on the right side of the screen. These also can be performed with a small weight or canned goods for 10 repetitions 3 times a day before your surgery. A lower extremity exercise can be included as well. These exercises can be done on your operative side as well as the non-operative side. The quad set can be performed by sitting up against the headboard of your bed or having your leg out straight propped up on an ottoman or in a recliner. Tighten the muscles on the front of the thigh while pressing down the knee toward the surface underneath. Do not hold your breath. Keep the muscle tight for a count of 5 and then relax. You can perform these throughout the day. If you like to read, you can do 10 at the beginning of each chapter of your book, or if you watch TV, you can do 10 at each commercial break. Smoking and surgery. We strongly recommend that you stop smoking several weeks before surgery. Smoking reduces blood supply and oxygen to your body and slows down bone and tissue healing. It also increases your risk of infections. Pre-admission testing appointment. Your surgeon's office will schedule this appointment about a week before your surgery. It may include blood tests and other tests such as an EKG, X-ray, or urinalysis to help your doctor check for health problems that may need to be addressed before your surgery. The nurse will ask you many questions about your health history and your medications. You should expect this appointment to take between 2 to 3 hours to complete. Please bring an ID such as a driver's license, your insurance card, a complete list of all your current medications, copies of any surgery clearances you have completed, and a copy of your living will or power of attorney if you have them. Next, we'll talk about preparing your home for your recovery after surgery. You'll want to perform a home safety check to identify any items that may need to be moved prior to your returning home. The goal here is to avoid any items that may be a risk of causing you to fall. Identify the easiest access into your home. Note if there are any stairs, and if so, do they have a handrail? If there is no handrail, consider installing one for safety. You can have friends or family help arrange furniture so you can walk around safely with your walker. You'll want to remove any tripping hazards such as throw rugs, cords, or clutter on the floor. Get your favorite chair ready by stacking firm pillows on top of it if it's too low. And use a small table next to your chair to easily reach items such as books, remote controls, your phone, and water. You want to stay hydrated. Move essential items to waist level for easy access so you don't have to reach up or stoop down. A bed that is too high or too low will be hard to get in and out of after surgery. Install risers if it is too low, or you may need to remove the mattress from the frame if it's too high. Look at the lighting of your home. Is there enough light so that you can safely walk from your bed to the bathroom? Install night lights in hallways, bathrooms, and bedrooms to improve visibility at night. You'll want to take a look at your bathroom as well. This picture will help you identify some areas that may need to be addressed. Please use rubber-backed bath mats to help prevent a slip and fall. Consider installing a handheld shower or grab bars for stability. A bath bench or chair is recommended when taking showers for safety as well. A long-handled sponge is also useful to wash hard-to-reach areas such as your feet or lower legs. A 3-in-1 commode is often recommended at Discharge and can be used as a shower seat as well as an elevated toilet seat. You'll want to obtain non-skid, sturdy shoes now to wear after surgery and avoid wearing flip-flops or sandals. You'll need to use your walker for at least a week or two until your strength and balance return and you're cleared by your physical therapist to walk without it. Again, please plan to have someone with you for the first few days after surgery to help you move around safely. Avoiding infection is an important goal for your surgery. So please clean your house thoroughly prior to your surgery and have someone change your bed linens frequently every 2 to 3 days after surgery to reduce the amount of bacteria you're exposed to. Taking these steps will help reduce your risk for infection. Next, we'll address getting ready to come to the hospital. The night before your surgery can feel a little bit hectic, but we want you to try to have a nice dinner and try to relax the night before. Place clean sheets on your bed, and prior to your surgery, you'll have to take 2 showers, one the night before and one the morning of your surgery. You'll take a shower with antibacterial CHG wash as instructed at your pre-admission testing appointment. Please take any medications that you were instructed to take with a full glass of water. You may drink water throughout the night, but nothing other than water after midnight. The morning of your surgery, you will take your second shower with the antibacterial CHG wash as instructed in your pre-admission testing appointment. Take any medications you were directed to take with sips of water only. Do not eat or drink anything after midnight. Please arrive on time to the hospital. You may not know the exact time of your arrival time until the day before when you are contacted by your surgeon's office. Friends and family are allowed to remain in the surgical waiting area for updates on your surgery. What to bring to the hospital. You'll need to bring your glasses, dentures, and any hearing aids if needed. Any of your preferred hygiene items, such as your toothbrush, toothpaste, or deodorant. A clean set of comfortable, loose-fitting clothes and non-skid shoes. They must be able to fit over a swollen and bandaged leg. Please leave any valuables at home, such as jewelry or computers. You'll need your insurance card and a form of payment for the Meds to Beds program. Please do not bring your own medications to the hospital on the day of surgery. We will already have a record of those from your pre-admission testing visit. Do you have a CPAP that you use at home? If so, please bring that to the hospital with you as well. Now we'll discuss your surgery, whether you're having a total hip or a total knee. Total knee replacement. This picture shows severe osteoarthritis that has more than likely led to your knee replacement on the left, and the components of a knee replacement on the right. You'll see components for the femur and the tibia, which are both bones that make up the knee joint. There's typically a plastic spacer that is placed between the two. This slide shows the components of a total hip replacement. Your surgeon will determine whether the anterior, lateral, or posterior approach is best for you. Within the components, you will notice a femoral component and an acetabular component, which make up the ball and socket of the hip joint. Please click on the hyperlink to play the video of the type of replacement that you are scheduled for. The type of anesthesia you will receive will be determined based on what is best for you. This will be determined by the surgeon and the anesthesiologist for your surgery. General anesthesia includes an inhaled gas along with IV sedation. You may be sleepy for a few hours after surgery, but you're able to feel and move everything immediately after the procedure. Spinal anesthesia is when numbing medicine is injected into your back to numb you from the waist down, along with IV sedation. You may wake up quickly, but you will not be able to feel or move your legs for a couple of hours after surgery as the anesthesia wears off. You will not be awake, and you will not hear or remember your surgery with either of these choices. What can you expect after surgery? You'll be in the recovery room for 1 to 2 hours. You may have a dry mouth from the anesthesia, and your throat may be sore from the tube inserted in surgery. Your arm or hand will have 1 to 2 IVs, so fluid and medications can be administered. Your vital signs will be monitored frequently, and your nurse will ask you about your pain. And pain medicine will be started if you need it. If you feel cold, you'll be provided warmed blankets. Feeling cold is not good for healing, so don't hesitate to ask for a blanket. You will be given oxygen to help you wake up, and your surgeon may order an x-ray of your new joint that will be done in your bed in the recovery room. Once you're awake and stable, if the plan is for you to spend the night, you'll be transferred to your hospital room. Admission to the hospital. Your orthopedic team will consist of your surgeon and a hospitalist, which is an internal medicine doctor, a registered nurse, nursing assistants, physical therapists, pharmacists, care coordinators such as a discharge planner, and your orthopedic clinical coordinator. This image shows a typical room on the orthopedic unit at South Seminole Hospital. You'll have a private room where one adult may stay with you overnight on a pull-out Murphy bed. Important information about your procedure and your nursing staff is communicated and posted on your whiteboard in your room. This board will also contain information including your nurse's name and phone number, and may also show when your last dose of pain medication was taken. You will also have a call bell to call your nurse or nursing staff for any needs you may have. Please notify your nursing staff before getting out of bed. The first few days after surgery, you will need someone to be with you to ensure that you're moving safely and to avoid falling. Once you arrive to the nursing unit, you'll receive an orientation to your room. Your nurse will ask you about your goal for pain. It's important to know that some pain will be present following surgery, and no pain is not a realistic expectation. So, it's important to communicate your pain level and any changes in pain level to your nursing staff in order to be medicated appropriately. Your vital signs will be checked at least every 4 hours, and you'll begin sipping liquids and progress to eating a regular meal over a few hours. Your day of surgery is called post-op day 0. The nursing staff or physical therapist will assist you out of bed the day of your surgery, usually within the first 4 hours of coming to your room. You'll be assisted from the bed to the chair or the bathroom. Remember, early mobility means you'll be less likely to experience complications such as blood clots, pneumonia, and severe constipation. The sooner you begin moving your new joint, the better your recovery will be. Taking care of you is our biggest priority. That's why it's so important that you always notify a staff member before getting out of bed or getting up from a chair. Even though you may have already been up walking and felt amazing, it's still super important to have assistance with your mobility. Remember, you just had surgery on your hip or knee. The anesthesia that you had can make your body weak. And if you received a nerve block, your leg may be numb and difficult for you to move. And a fall is the biggest danger to your knee replacement. Therefore, a staff member must always be with you when you get up. Our staff are trained to immobilize you, whereas a family member or friend could potentially hurt themselves or you, unintentionally of course, by trying to assist you. It's our job to make sure that you can get around safely, and we're happy to help. Next, we'll talk about managing your pain after surgery. Here at Orlando Health, we use a 0 to 10 pain rating scale to measure pain. 0 is no pain at all, and 10 is the worst pain imaginable. As discussed earlier, your nurse will talk with you about your pain goal. This number will represent a level at which you will still be able to participate with physical therapy. We want to be able to help you achieve this goal, so think about what your goal will be. This picture indicates the facial expressions that coordinate with a number on the scale. We'll often refer to this if you are having difficulty assigning a number to how you're feeling. Pain management is an important piece of your recovery. It's important to note that stiffness, soreness, and heaviness of the leg are not considered to be pain. Pain is generally sharp and intense in nature. Some pain in your joint after surgery is normal, so let your nurse know when you're experiencing pain. Do not wait until the pain is unbearable. There are many different methods used for pain control, including IV pain meds, pain pills, ice packs or cold therapy, nerve blocks, movement, repositioning, physical therapy, relaxation, and distraction. Some common side effects of pain medicine are dizziness, drowsiness, itching, and nausea and vomiting. In some patients, these medications, especially the IV pain meds, can slow breathing and cause blood pressure to go too low. We do not share this with you to scare you, but to inform you of the common side effects. In the event that you may feel any of those listed, please notify your nurse or medical staff. The sooner you transition to oral pain pills, the better you'll typically feel. A multimodal approach is when a variety of medications are used to control your pain after surgery. This may consist of nonsteroidal anti-inflammatory drugs known as NSAIDs, muscle relaxers, and narcotic or opioid medications. In regards to IV pain meds versus oral pain medication, IV pain meds work quickly but do not last long, and oral pain meds typically take longer to begin working but have longer lasting effects. The goal is to transition to oral pain medication very quickly, as this is what you will be taking home. This also will help reduce the side effects of the IV pain medications, as we discussed earlier. Other techniques used to help manage your pain may be ice packs or cold therapy, or a cooling machine that circulates ice water through a pad wrapped around your joint. What will be used with you will depend on your surgeon's preferences. An additional technique that may be used to help manage your pain may be a nerve block placed by anesthesia, which is an injection of numbing medication to the nerve that supplies your joint. This is generally performed prior to surgery after you're sedated and can help control pain for the first 24 hours after surgery. Your surgeon may use a medication injected into the joint during your surgery called Exparel. This is a numbing medication that can control pain for up to 3 days after surgery. If this medication is administered, you will be required to wear a teal band for the first 4 days after surgery, indicating Exparel was given. This has to be worn even when you're at home. This is a safety measure to protect you against any other medications being administered that might react with Exparel. Please note as well that your pain may increase in the 2 to 4 days following surgery as this medication begins to wear off. Outside of medications and other modalities, movement, repositioning, and physical therapy are all key techniques to manage your pain control. Early mobility of your new joint will help gradually relieve pain and muscle spasms that may be present. What else can I expect after surgery? You may notice after surgery that you have inflatable sleeves around your lower legs or TED hose. These items are used to help prevent blood clots from forming. With certain approaches for a total hip replacement, an abduction pillow may be used after surgery. This is only used with a posterior or lateral approach, and it prevents certain movements that could damage your hip. You may also notice a hemovac drain that is used to pull any excess drainage away from the surgical site. A CPM, or continuous passive motion machine, is sometimes used after a total knee replacement. This device is a computer-controlled machine that moves the knee into flexion and extension, bending and straightening the knee. You will typically only see these if you are a patient of Doctor Who Damage. You may find you have a knee immobilizer following surgery if you had a posterior approach of a total hip replacement as a precaution to protect your hip from unwanted movements, or if you've had a nerve block with a total knee replacement. This aids in control of the knee until the nerve block wears off. There are multiple surgical site closures available. The type used will be determined by your surgeon depending on what is best for you. Notify your surgeon of any allergies or skin sensitivities so they can determine the most appropriate choice, which may be a gauze dressing. Depending on the dressing chosen by your surgeon, you may have a bulky gauze dressing that can be removed in 1 to 2 days. Another dressing is a Mepilex dressing, which is a self-adherent, soft silicone foam antimicrobial dressing. You are allowed to shower with this. Another dressing type is a Prineo dressing. It's a fine mesh with skin glue. This dressing will stay on for 2 or more weeks and will be removed when you return to your surgeon's office. It is completely waterproof and you can shower with this dressing as well. An Aquacel dressing stays on for 5 to 7 days. It too is completely waterproof and you can shower with this as well. It is important to elevate your leg after surgery. You'll want to do this by placing multiple pillows or a wedge under the ankle while keeping your knee straight. Never place a pillow or other support behind your bent knee. It can allow the knee to stiffen in the bent position. It can also increase the risk of a blood clot. The incentive spirometer is extremely important in preventing pneumonia after surgery. You'll take in a slow, deep breath while keeping the ball on the right-hand side between the lines. This may make you cough, which will help you get any secretions out of the lungs and help your breathing. Please do this 10 times each hour you are awake. If you're watching TV, you can do this during the commercial breaks, or if you're a reader, at the beginning of each chapter. A nurse will show you how to use the incentive spirometer. Do's and don'ts for total knee replacements. If you've had a total knee replacement, there are a few precautions that you will need to follow. You want to make sure not to force your knee to bend further than 120 degrees. Do not sit in low chairs. Do not kneel or squat. Avoid twisting your knee. Do not pivot or turn on the operated leg. And do not place a pillow under your knee while lying or sitting. A physical therapist can go over any of these precautions with you in more detail. You can stretch and move every 2 hours and avoid sitting for long periods of time. We do want you to take small steps when turning, and we do want to keep a pillow between your knees when you're lying on your side. Ask your doctor when it's safe for you to stop your precautions and return to sporting and sexual activity. For posterior or lateral surgical approaches for a total hip replacement, we want to make sure that you do not bend your hip more than 90 degrees. You want to avoid leaning forward or squatting to reach something. You do not want to bend over to put on socks and shoes or pick up an object from the floor. You do not bring the operated leg across the midline of your body. You do not pivot on your operated leg. And with a posterior lateral approach, you don't want to let your leg roll too far inward. And with the anterior lateral approach, you don't want to let your leg roll outward while lying on your back in the bed. You also do not want to turn your foot inward or outward in standing. You do want to step forward with your operated leg first. You want to pick up your foot when you step to turn rather than pivoting. You want to make sure to extend your operated leg forward before sitting down. You do want to keep a pillow between your knees when lying on your side. And you want to ask your doctor when it's safe to discontinue your hip precautions and return to sporting and sexual activity. For the anterior surgical approach for a total hip replacement, you want to make sure to avoid extreme motions of the leg. You don't want to walk too far at one time. Avoid standing in one place for too long. And don't overdo it. Try to walk a little bit more each day. With this approach, you do want to make sure to step forward with your operated leg first. Pick your foot up and step to turn. You want to make sure to extend your operated leg forward before sitting down. Keep a pillow between your knees when lying on your side. And make sure to ask your doctor when it's safe to discontinue the above precautions and return to sporting and sexual activity. Now let's look at post-op day 1. Your surgeon, your surgeon's PA or nurse practitioner, or a resident will come see you. If you have a catheter or a drain, it will typically be removed. And your care coordination team will start to arrange items needed for your discharge. Physical therapy will typically see you twice before you go home, unless otherwise cleared by your surgeon. You will be discharged when the surgeon, hospitalist, and physical therapist all approve. Your physical therapy treatment sessions will typically include 2 sessions on post-op day 1. Typically, you will attend a joint camp on the first day, which is a group session with other patients that have undergone a total joint replacement as well. One family member is encouraged to attend for instruction on your home exercise program and mobility training. On post-op day 1, physical therapy will work to achieve independent mobility, increased walking distance, and discharging you home as this is the goal. Your goals and expectations for therapy at discharge will be that you will be walking with a walker. You may need some adaptive equipment for activities of daily living assistance for several weeks to help you with those activities that may be contraindicated by your precautions. Outpatient therapy may be ordered for further strengthening and mobility, but you may also receive home health physical therapy prior to this. Progress with therapy is individualized. The more you do for yourself, the quicker you'll reach your goals and the better the outcome will be. If you do not already have medical equipment at home, as mentioned, the care coordinator will be arranging for these upon your discharge. You may be recommended to have a 2-wheeled walker and a 3-in-1 bedside commode. Depending on your surgeon preference, home health visits by a nurse and physical therapy may be ordered. You will have printed instructions for your continued recovery at home, and you will have an opportunity to have all of your questions regarding your recovery answered prior to discharge from the hospital. As mentioned earlier, some common home equipment is the 3-in-1 commode and the rolling walker. Some home equipment that you may wish to purchase are some of the following items: a sock aid, reacher, leg lifter, shoehorn, and a long-handled sponge. These items are typically not covered by insurance, but can easily be purchased for reasonable prices on Amazon, at Walmart, Walgreens, or CVS. A sock aid is to help you put on your socks, and a long-handled shoehorn to put on your shoes. The reacher to pick up items that you may have dropped on the floor, a leg lifter to help assist in lifting the leg in and out of bed, and a long-handled sponge to wash hard-to-reach areas. Discharging from the hospital. Upon discharging from the hospital, it's typical to experience an increase in pain 2 to 5 days after surgery. The pain increase is normal as medications given during the surgery begin to wear off. On the y-axis, you'll see your pain level, and on the x-axis, you'll see your post-op day number. As you can see, there is an increase in pain on day 2 to 3, but gradually tapers back down on day 4 to 5. Pain management after discharge. Pain medicine will be prescribed for a short period of time after surgery. You're typically given 3 to 7 days worth. Please take your pain medications as prescribed. You'll want to wean yourself down as soon as possible to avoid side effects. Take your medicine with food and/or a snack to help lessen nausea and vomiting. And remember that alcohol can be dangerous if mixed with pain medicine. Once you leave the hospital, any change in your pain medication or refill prescription must be picked up in person at your surgeon's office. Constipation is a common side effect after surgery and can become serious, so make sure you stay on top of it. Eat foods high in fiber, drink plenty of water, move around as much as you can tolerate, and take a stool softener as prescribed. If you haven't had a bowel movement by day 5, please don't hesitate to take a laxative. Here at Orlando Health, we utilize a program called the Meds to Beds program. With this program, your medications can be filled and the medications can be delivered to your bedside prior to discharge. This cuts down on any unnecessary trips to the drugstore while you're trying to recover at home. Our pharmacist will call you typically the morning after surgery to speak with you regarding the program. Remember that healthy diet we talked about prior to surgery? You want to make sure that you continue that after your surgery for a better recovery. Remember, eat a healthy, well-balanced diet. Make sure your protein intake is 1 gram of protein per 2 pounds of body weight. If you have diabetes, keep your blood sugars well controlled and stay well hydrated. Remember, 8 to 10 cups of non-caffeinated fluid daily before and after surgery, unless you've been told otherwise. And also, myplate.gov is a great resource for your dietary guidelines. Preventing an infection is key in your recovery. The number one way to prevent infection is hand washing. Also, don't allow pets to lick your wounds or sleep with you. Pets have a bacteria on their skin as well, and it could transfer to yours and cause an infection. We love our pets, but just keep them at bay for a little bit. Change your bed sheets 1 to 2 times a week. Remember, we sweat, shed skin, and have bacteria on our skin that gets on our sheets. And no smoking. It increases the risk of complications and infection. And for diabetics, blood sugars that are too high or too low could put you at risk for increased infection and/or delay your wound from healing. Following discharge, it's normal to have a few symptoms around the knee or hip. Normal symptoms would be an increased swelling in your leg or calf, bruising around your knee or hip or calf, and redness around your surgical incision. What's not normal is to have severe swelling in your leg and calf, severe bruising around your knee, hip, or calf, a red area that's hot to touch around your surgical incision, or drainage, especially if it's green, yellow, dark red, or foul smelling. Please notify your surgeon immediately if you have any questions related to your surgical site or notice any of the symptoms that are not normal. Incisional care. You'll receive discharge instructions letting you know how to care for your incision and how to change the dressing. Some things we want to consider is to not use the same washcloth or towel for your body and incision. You want to avoid baths, pools, jacuzzis, lakes, or ocean swimming until okayed by your surgeon. And don't apply anything to your incision unless instructed by your surgeon. Please do not apply any ointments, creams, lotions, powders, peroxide, or alcohol to the incision. It may actually increase your risk for infection. Let's talk about blood clot prevention. We want to make sure that we're doing everything to avoid any sort of deep vein thrombosis, otherwise known as a DVT. It's not meant to scare you, but we want to make sure that you're informed. Some signs and symptoms of a blood clot could be increased swelling in the affected leg, red or discolored skin on the leg, a feeling of warmth in the affected leg, increased pain in your leg that often starts in your calf and can feel like cramping or soreness. The reason this is dangerous is that if a piece of the clot breaks off, it can cause a heart attack, stroke, or severe lung damage. So we want to just make you aware. With the blood clot prevention, your surgeon will give you a medicine to decrease your risk of developing a blood clot. This may be aspirin, Eliquis, Xarelto, or a Lovenox injection. It's very important to take it consistently, as prescribed, and for as long as your doctor has advised. Please make sure to report to your surgeon any signs and symptoms you may develop right away. How can you prevent those DVTs from happening? Number 1, take your blood thinner exactly as prescribed. Stay well hydrated and drink plenty of water, and move around as much as you can tolerate. Early mobility is key in preventing DVTs. After your surgery is completed, you want to make sure to keep it in mind when having any type of dental procedure or any other invasive procedure. You always want to make sure to tell the physician that you've had a joint replacement. You want to avoid dental work for the first 6 to 12 weeks after your joint replacement. Prophylactic antibiotics are usually prescribed to help prevent a possible infection. It's typical for your surgeon to recommend this for the rest of your life. When to call your doctor. We want to give you some tips on when it's appropriate for you to notify your surgeon of anything that's going on after your surgery. If you're having any chest pain or difficulty breathing, call 911. You want to call your surgeon if you have any excessive pain or swelling in the knee or calf, any pain that is increasing or not controlled by your pain meds, if you get chills or a fever of 101 degrees or higher, which may be a sign of infection, any unusual redness, heat, or drainage at the incision site. If you also notice any numbness or tingling in your lower leg or foot, or a change in color of your toes, which can be pale, dusky gray, or blue, make sure to give your surgeon a call. Following discharge, you'll want to make sure that you have follow-up appointments with your orthopedic surgeon, your primary care physician, and any specialists that may have given you surgical clearance. With your primary care and specialist, it's typically 1 to 2 weeks after surgery, and your surgeon will indicate to you when they would like for you to be seen. Thank you again for choosing Orlando Health's South Seminole Hospital for your total joint replacement. If you have any questions prior to your surgery, please contact our orthopedic clinical coordinator, Septus Ricanala, at 321-842-2976. Thank you, and best of luck. Please take a moment to scan the QR code or click on the link below to capture your attendance that we can report to your surgeon. This will ensure that we have communicated essential information regarding your procedure during this class.